beautiful, not too beautiful
Not
weather.
too beautiful.
Memorial weekend here,
It's
50
a
degrees.
washout, right?
We were all supposed to go to the farm, Pennsylvania.
Oh, that's right.
Everybody backed out because of the rain, which I don't understand why, because it rains every Memorial weekend.
It
And
does.
usually not the whole weekend, like today. It's not raining. It threatened rain.
It's threatening rain.
Maybe it will, maybe it won't, but that's Memorial weekend.
Yeah.
Anyway, I'm Dr. Gabriele Jasper with Painless with Dr. Gabriele Jasper, MD, interventional pain physician. And when I say interventional pain physician, I mean that I do some form of intervention, some form of procedure to get rid of pain. I do not prescribe pain medication, so please don't ask. And I figure out the pain generators. And when you come to see me in my office, I will explain to you on your first visit every pain generator you have in your spine
Yeah.
that's causing you to have pain. And I'll explain to you that most people that are elderly and have a bad back have at least 5 or 6 different pain generators. And it's hard to understand this for a lay person. It's hard to understand it sometimes for physicians, especially the pain doctors that are doing a series of 3 epidurals and sending them to surgeons. Because an epidural is really just treating one thing, and they treat maybe some mild spinal stenosis and some mild pinched nerves. And especially in a young person, the epidurals work. But when you're older and you have severe, moderate to severe spinal stenosis, you got an extremely tight canal, neuroforamina, pinching a nerve, epidurals are probably not going to work.
Right.
But you know what? Jeremy, I'm here with Jeremy.
Hey, guys.
And Jeremy was telling me that we had a bad Yelp review because a patient told me that he had 8 epidurals in his life.
From previous doctors.
From previous doctors.
Yeah.
And that's a pretty good subject to talk about today.
Yeah.
I usually get two questions when I say to somebody, the first thing I'm going to do is an epidural. And the first question is, why would you do an epidural on me when I had 8 epidurals, like this particular guy, 8 epidurals before in my life?
Right,
anytime your life, 8 epidurals is probably not even a lot.
And if you go to other doctors, they don't do a hell of a lot much.
So don't drive me off of this track here.
Yeah.
8 epidurals. And that was the first question. Why are you going to do the same? Why are you going to do the same thing? Which actually isn't the same thing. The second question is when they come back after I do an epidural, they ask me, why did yours work and the other doctors, multiple doctors, didn't work?
Right.
Why? And I try to explain it to some this guy had to be a new patient.
Yeah.
I try to explain it to the new patients, and they probably say, oh, this guy's cocky, like, oh, does you think he's magic? He's going to give the injection, it's going to work. And guess what? They come back and they ask me, why did mine work? Why did it work? Well, like I say, there's a few reasons. Number one, I use probably the most expensive steroid medication, and any other medication, I use good stuff. And you get what you pay for. You drive around an old Volkswagen, it's not as good as driving around a brand new Cadillac. It's,
right.
It is what it is.
Yeah.
So that's one reason I use better medication, because people try to tell me, buy this medication, you'll save $100,000 a year. I don't care about saving $100,000 a year. I want my patients to go out there and say, Dr. Jasper gave me an epidural. After 8 epidurals, I feel good.
Right.
Now, it doesn't always happen, and I tell them right up front, I said, these people that gave you the epidurals probably did a pretty good job, and maybe they're using the same medication. Maybe when I give you the epidural, it's not going to work.
Gotcha.
But there's another reason why I have to give the epidural, because if you come into the office and you need something more advanced, like if epidurals don't work, and you haven't had an epidural in 2 or 3 years, the insurance companies will not approve the next step in your treatment unless you failed epidurals within the last year. It's a known fact.
Yeah.
Most of the time, I think that's ridiculous. But then at the same time, they know that in the different hands of somebody else, it might work. And guess what? They save, the insurance companies are not stupid. They'll save all that money They'll save all that money for the next step and the next step and the next step.
Right.
If you do an epidural and it actually works, right? So this particular guy didn't listen to me. He had at least 5 to 6 pain generators. And I gave him an epidural, which I told him, listen, it might work, it might not work, but you need it to go to the next step, and you need probably the next step.
Right.
Now this guy, he gives me a Yelp review, a bad Yelp review, saying after I told him that I had 80 epidurals, he gave me another epidural that didn't work. Well, you know what? No shit. I explained it to him. I don't do anything just because I want to do it.
Right.
You know, I do it because of the fact that it needs to be done one way or the other. Then you get the people that don't listen to what you say because it's not technically, it's a little difficult.
Yeah.
You know, if a person comes in and they got spinal stenosis, they got a pinched nerve, that's 2 pain generators.
Right.
They got arthritis in the spine, that's 3 pain generators. They got discogenic pain, which means pain's coming from the disc, that's 4. And then you got modic changes, which, it's, this is another topic, but modic changes where you got vertebrogenic pain, which is coming from the actual vertebral body. This vertebral body.
Right.
And then there's more. I mean, off the top of my head, there could be a lot more pain generators. A person could have a compression fracture.
Right.
But that's a little bit more rare. But that's be 6 or 7. And I try to explain to these people that, or anybody, that you could have 5 to 6 pain generators causing the same kind of pain. And how do you distinguish between them? You got to have experience. You got to know how to read MRIs. And you got to know the history.
Right.
And you got to know the pain, what type of clinical symptoms. You could kind of narrow it down to a couple by, for example, patient has more pain in the morning when they get up or when they sit down for a long period of time, they get up. That's usually arthritic pain.
Yeah.
A patient has more pain when they bend over, when they sit down for too long. That's usually discogenic pain. It's probably the same kind of pain when you have modic changes with vertebral pain, right? Which is bending over and stuff like that and sitting down too long. But when you have sciatica pain shooting down the leg, especially when you're sitting down,
that's a nightmare.
That is from a pinched nerve.
Yeah.
That's called radicular pain, right? I mean, it goes on and on and on. Now, most of the time, these individual pain generators got to be treated individually. There's no such a thing as doing major spine surgery and just treating it all at once. It ain't going to happen. It ain't going to happen. People go for major spine surgery, you address maybe one pain generator, and they finish, and they still got the same pain because they got pain from another pain generator.
Right.
It's the interventional pain docs that treat individual pain generators, like I do. And eventually we get to it. And I also tell patients in the beginning, if you don't have patience, because it's time consuming, if you don't have patience, I'm not the doctor for you. Because I do one pain generator at a time. Because first of all, you gotta, it's a process of elimination. I hate to say it, but it's not a direct science. Certain things are, but you have to be able to diagnose what it is. And I mean, you could have sciatica pain from piriformis syndrome, which is a pinched nerve, the sciatic nerve from a muscle, for God's sakes. I mean, that's very hard to figure out. That's rare, but it's very hard to figure out.
Sure.
But you got to allow the doctor, you got to understand that the doctor's there to help you, especially if he's an honest doctor, and it takes time. Some people just don't have the patience. They don't have the patience. It could be some of them don't even believe half the stuff you say.
Yeah.
Like I'm making it all up. And then you got the people who are diehards that, that they don't get any better until you fix the last pain generator. Then all of a sudden they're good. Sometimes it takes up to a year.
Right.
I got a patient who was a testimonial. She goes, Doc, it's been 1.5 years you've been working on me. And I've been slowly getting better and better and better. And now I'm finally 100% pain-free. But it took 1.5 years. And I'm glad I had the patience, she said. But you can see that on my testimonial. You got these people. I don't know what was the other one you said that complained?
Oh, here I have them all here. I just want everybody to know that the majority of these are 5 stars. Okay, let's just say that right now. Like we had one that was just complaining about a 2-hour wait. I mean, the one thing that patients don't understand is that if you go to any so-called pain management doctor, you're waiting there for 2, 3, 4 hours anyway. Because the doctors have to spend the same time with everybody else. That's what you're waiting with. And when you get into the office or into the exam room, you're getting that same amount of time and you're not complaining then.
Well, you might be getting more time or less time. Depends on
Yeah,
what's
it
going
depends
on.
upon what's going on with you.
I mean, if I get a new patient comes in, has no MRIs, has pain, I can't make a diagnosis. So I explain to them what I could do, what they possibly might have based on their symptoms, which could take, 5 minutes. And I say, well, go get I'm going to give you a script for an MRI. You get the MRI, and I will spend time and make sure you understand what your pathology is, what's going on with you, and how we can fix it. Those are the people when they come in after with a brand new MRI, is where it might take 20 minutes, 45 minutes. But you never know, and then people don't understand that, it's kind of, I hate to say, it's kind of like a dentist's office, right? To a point where it's not like you go to a family practitioner, which you could pretty much schedule everybody at the same time, right? And you know what, patients coming in for. Maybe it takes an extra 3 minutes to write a script for them. But we get patients sometimes call up in the morning. I can't move. I'm in severe pain, shooting down my leg. It happened yesterday afternoon. This and that. Well, guess what? If they're in severe pain, I'll have them come in that day.
Yeah.
It's like somebody calls a dentist's office and said, listen, I got severe pain. I think I got an abscess. You can't let that guy go a week.
Right.
Or the woman go a week. Yeah. You got to treat it in the same. I think it's the same as pain. So we'll start off the day with 30 patients, and at the end of the day, sometimes we got 40
Right.
total. So people got to understand that too. It's not just them coming in. And we could have 30 patients, 40 patients, and out of the 40 patients, everybody's easy, and we get done at 3 o'clock in the afternoon, and everybody's waiting there 10 minutes. But then you throw a wrench in there, you get a couple of people that don't respond the way they're supposed to respond, or you get some new people that have 6 or 7 pain generators. You explain it all to them and let them understand it, and the half of them don't listen to you, and then you got to repeat it again. You got to have patience.
Yeah, yeah, and then they don't listen to you again. That's the important thing about all this. One guy he was claiming that you operated on L5S1, but he thought it was going to be L4, L3.
L4, L3?
Yeah.
Well, he's not even saying it right. Obviously, the guy that didn't understand, wasn't listening to me when we
Yeah,
talked.
he says, and then he says, oh, he went over it with me under anesthesia. I guess that's twilight. So he was communicating with you and all of that.
Yeah, sure.
And then he says, then he says, when I was unconscious, in big words, bold face. You know what? A lot of people say that, oh, he's so full of himself. He's so, but you're confident. You know your skill sets. You're a professional, and you've been at this for so long.
Jessica figured out the other day. I've been a doctor for 36 years.
36
years I've been a doctor. It's hard to believe. I still, my brain thinks I'm like 20 years old, and my mind thinks my brain thinks I'm 20 years old, and my body thinks my brain's an idiot.
Yeah.
But I mean, this is typical. And I know the situation here. I can tell you exactly what happened with this person. I explain everything to the patient a million times. Like yesterday, I had a new patient. I explained to him, he's got 5 or 6 pain generators. I explained every one of them. And then I told him what I was going to do for the one I'm going to treat the pain generators. You're going to get the most relief with the shortest period of time and the safest procedure. And I explained that more in detail. And I said, now, Like I said, you got to have patience
Mm.
because we're going to work on them individually. I said, don't think you're going to remember everything I told you today, because you're not. But I will go over this every time I'm going to treat a pain generator. He says, Doc, thanks, because that was so much information.
Yeah. And
But let me finish.
Go ahead.
But this is typical that they don't listen.
Mm.
I tell them I'm going to operate on L34 or L45 or whatever it is. And I explain everything. I show it to them. I put it on the thing. Listen, there is so much redundancy in our office and in the surgery center. We do not operate on the wrong level.
Right.
We mark the patient. We write down on every little thing. The nurse that goes through 5, 6.
The patients have to sign what's being done to them.
Yeah, absolutely.
Yeah.
Now, if a patient asks me while they're under anesthesia, so Doc, and it happens a lot, Doc, so what are you going to do to me today? What do you mean, what am I going to do to you today? And you're under anesthesia, and I explained it to you 100 times, and then you also signed, listen, I'm not complaining about patients. I guess I am. But today the topic is a little bit about, patients that are disgruntled for ridiculous reasons. And this guy's, for the first time, you think I'm, as a physician that's been doing this for 36 years, going to explain to a patient while they're under anesthesia on what I'm doing to them that day? Come on, let's be realistic. Yeah. That does not happen. Even in the doctor's an idiot and negligent isn't going to do that.
Right.
So, I mean, I hope these people are smart enough that read it say this guy's an idiot.
If you didn't have your I's dotted and your T's crossed, you would be getting into a lot of trouble.
No, you get your I's dotted, T's crossed, and people sue you anyway because they want the money.
Yeah, you're right.
This is what happens today, especially when the economy goes down a little bit, when gas prices go up a little bit, everyone wants to sue you.
Sure.
They'll sue you for any reason.
They feel like they got something coming to them, and it's coming from you.
And that happens. So what were you going to say?
I was going to say that this is pretty much a perfect case of a patient who isn't paying attention to you whatsoever, no matter how many times you tell them. They even got the medical information completely wrong. They wrote that all down, but to a layman reading that, they're looking, their eyes bulge. But the good thing about all of these reviews, these are the 1 or 2 bad reviews, they are the minority in all of them. We get 5-star ratings usually across the board.
Well, how about reading the good one for is there any good ones?
Yeah. Tons of good ones. Let me see. Oh, this guy sent my neighbor to Dr. Jasper. He could not walk with a walker. Now he can. Gave me my independence back, he said. Thanks, Doc. Edward Z. Very positive experience with Dr. Jasper and staff. Had terrible low back pain. Had bilateral epidural. This is a guy that's paying attention. With great results and very little pain for a couple of days and no pain after 1 week. This one. Oh, this is a good one. I've been seeing Dr. Jasper since November, and I find him to be amazing. I have had back pain and numbness in my leg for 30 plus years and a tremendous fear that I would have to undergo surgery. I have heard horror stories about back surgeries making things worse, which is why I let the issue persist as long as it has. It's that complacency. Thanks to Dr. Jasper and taking the process one step at a time, we have accomplished pain reduction and continue to work on the issues causing numbness, etc. I like that he takes his time explaining procedures, and I love the fact that he doesn't jump in with both feet and perform deep, painful, long recovery surgeries. I like that we try this and we see how we do, and then pinpoint what else can be done. I truly believe Dr. Jasper wants to see his patients out of pain. You may take my post as he is dragging this out, but I see it as let's not go crazy and put you through tremendous pain only to find out that you have to do something more, and the other on the other end. In my opinion, that is about the dollar, not the patient. We're not things on an assembly line. We're live and just want help. Dr. Jasper will, all in caps, help. He will do everything in his power, and thank God for him.
Right in the beginning, that's the epitome of what I do.
Mhm.
That guy, he's got it. What was his name?
This is Liz C.
Liz C. All right, so beautiful woman.
Yeah.
What? It's right in the beginning. How long did she say it took me? Where was she doing?
Oh, she was in pain for 30 plus
No,
years.
she said I was with Dr. Jasper, sir. In the beginning, he
Mm.
said how long, but either way, it took her quite a long time to do it. She put it right in a nutshell what we've been talking about today. As far as I pick one pain generator at a time.
Yeah.
And it takes time, and you can't do one thing and just think you're going to get everything.
I think that's a perfect review that answers the other one we were just talking about.
Yeah.
Yeah. This is a patient who is understanding what you're doing. Okay.
Listen to what I said.
Every step at a time. They understand your process. Okay. That this is what happened. This is what you miss.
And that's probably 98% of my patients.
Yeah.
But every once in a while, you get somebody in there that's just not happy with themselves, I think.
Or they're disgruntled by, maybe other people they've gone to and nothing has happened. I can get that.
Well, you had that.
I had that.
You had that. You came and
Yeah.
you came on a stretcher and you walked out of there the first day.
But I had to put my faith in you.
Yeah.
That's it.
That's why we do the podcast. That's why we put it on the radio show. Hopefully, there's a few patients are waiting for this to go on the show tomorrow. Is he going to put this on tomorrow?
Yeah, it'll be on. It's going to be on tomorrow morning on 92.7 WOBM from 7 to 8 o'clock, just before church. It's a great listen, and you'll find out so much about your pain.
This lady, my brand new patient yesterday, says, no, actually, she wasn't a brand new patient. She hasn't been here in about 5 or 6 years. And she was doing good all this time. She said, Dr. Jasper, she goes, you are my alarm clock on Sunday mornings. It goes off at 7 o'clock in the morning, and I wake up and listen to you.
That's great.
I said, there's a lot of repeats. She goes, yeah, a lot of repeats, but they're good.
Yeah.
I said, tomorrow you're going to have a new one. I tell them I don't come as much anymore because let's think about it. How much can you possibly say in this? I don't want to be too redundant, but today, for example, there's no redundancy here. This is a good program today, talking about stuff that we need to talk about.
Sure.
People, for some reason, Yelp, or Google, most people that listen, I very rarely go on Google to do a review unless somebody pisses me off.
Right.
You know what I mean? So now you get all these things that people, you get so pissed off, you're going to give a review. Are you happy? You never give a review. So that's the problem. But it's amazing how many good reviews we have there.
Oh my God. Yeah.
Compared to bad reviews.
Well, people, if you're disgruntled, man, you're going to write about it all over the internet. But if you're happy, a lot of the times you don't do anything. And that's what we got here. It's hard to have faith if the medical community, when after many years, they don't know how to treat your pain. Well, that's when you go into a new.
Thanks, Meg.
That's when you go into a new doctor's office and you're so done with all these other doctors. You can't go into Dr. Jasper and then expect, and with an attitude like, yeah, I've heard it all. I don't want to hear you. Just do something. Fix me. I don't know where it is, but there was one other guy who complained, and then he ended up going to a surgeon who fused him. Because that's what some people think. Oh, I just fuse me and let me go. That one shot fix all. And fusing is not that.
Well, and there's a lot of problems with, and I don't want to. This is beating a dead dog, but
sure.
With the Advantage programs, Medicare Advantage programs, and people who don't have out-of-network benefits.
Yeah.
They end up doing all these big procedures because the insurance companies, even these bad insurance companies, for some reason, pay for these big, large laminectomies with disc replacements and fusions, but they don't pay for the new. When I say new stuff, this is not new. It's been around for years.
Yeah.
for years, and they still find a way not to pay for it. Medicare pays for it. Medicare pays for it. They don't pay a lot, but at least they pay for it. But these Advantage that promise they're going to pay for it don't. But I tell you what, we've been busy the last maybe 3 or 4 weeks.
Yeah.
Maybe 3 weeks. Seeing more patients than we ever saw, since last year. Why? Because the snowbirds. People have been dying to get treated, and they don't want to come back in between their winter stay, even though it's where they pay. Certain times you can pay $100 round trip ticket from Florida. So I mean, we got tons of patients coming in. We're making them feel good. Some of them had injections in Florida. Some of them worked. Some of them didn't work. Most of them didn't. But by the way, most of these patients, I know. I got the charts. I know what works. I know what I have to do to get them back the way they were before they left. And a lot of these patients it's maintenance. You got to maintain them. When you have a bad back, and a lot of people don't understand this. Very rarely, when you have a bad back, you're going to get rid of the pain 100%. But there are certain pains you get rid of. If you got a sciatica pain, you get rid of that, whatever's causing it, that sciatica. You have spinal stenosis, you open up the central canal. Once you do that, that particular pain goes away. But then there's always something else creeping up.
Here's this. Meg just posted again. She says, I had an injury to my back when I was 17. I'm 70 now. I don't expect to ever be pain-free. I just want to be able to get through the day. Well, Meg, you don't have to live with that pain. Many of the procedures that Dr. Jasper does are fantastic for senior citizens, all of them, really. You shouldn't have to be afraid. Come in, and you don't have to live with pain. Trust me, I was you once upon a time, and you have to take that leap of faith. Put your faith in Dr. Jasper. It might be a process.
What's Meg doing now for her pain?
Yeah, what are you doing now, Meg?
You could call in. Can she call in?
Yes, she can. Yes, she can. The phone number is 609 389 8695. It's right on the screen as we speak. The phone is on.
Yeah, a lot of times patients don't call, and it's always good to call,
Yeah. Although I don't know the password for it, but yeah. We got some more questions here. Let's see what she says. Pain management meds. She says.
You obviously don't come to see me.
Yeah, you don't have
to laugh, Meg, but
how long have
you my patient?
How long have you been taking those meds? Do they even work anymore? I was like you. I had to take pain medication, and you get hungry for it because it's the only thing that can. It's a quick fix. But then after a while, all that Percocet and Percodan or whatever, it doesn't work anymore. Your body gets used to it. So yeah, you must be. You don't have to live like that though, Meg. Come in if you got a loved one who can take you. If you're able yourself.
Well, 70 years old. She's young. She's my age.
Yeah.
Anyway, yeah, we could take care of you.
Sure. She's laughing. She says 4 years. I don't know.
4 years. Well, we'll take care of you.
So you've been on pills for 4 years? Is that what you're saying? That's a lot of time. And I guarantee you are not feeling the relief that you once did.
Call, and we'll make a diagnosis right now. Of course, to make a good diagnosis, I have to look at your MRI. Yeah, and make sure when you come to see me, you got an MRI.
Or, of course, yeah, you can call and make an appointment Monday morning at 732-262-0700. Meg, this is going to be the decision that changes your life for the better. Okay? Yeah, she says, maybe I'll call. Call us.
Maybe.
It's a big family there. All right?
All right.
And we'd love having you.
But don't expect me to give you pain medication.
She says it's way too long. What do you mean, the waiting? Is that what you're complaining about? Or not complaining, but is that what you're mentioning? Trust me, if you're at home sitting on your couch, we got a couch in our waiting room. Oh, and she has a recent MRI. Yeah, Meg, what are you waiting for? Come on, come see Dr. Jasper. You're not going to regret it. I promise you that.
Well,
that was, I think we covered some good ground there.
Yeah.
Yeah.
So what else are we going to talk about? We're going to talk about a lot of success stories about, there's a way today to, at least the company, it's called Viadis. We talked about Viadis, where you replace the nucleus in the center of the disc. You actually replace the center of the disc here, right? This one's broken and it's actually leaking out, causing a herniation. But that disappears when you have degenerative disc disease, especially when you have anywhere from moderate to severe. And once that starts, it's progressive. The disc gets smaller and smaller and smaller, and then you start to get what they call discogenic pain coming from the disc, which we used to diagnose doing discographies. We used to do IDEP procedures. We used to do endoscopic surgery for this, all kinds of stuff. But I had a patient, for example, last year that when I found out about this, the company, tells you basically it stops degenerative disc disease dead in its track. And I'm trying to figure out, how could it possibly, listen, what we do is we replace this with a true nucleus. So even the nucleus that's in there that's degenerative, that eventually got to go. What happened?
She says she's been on meds for years, and she says, "Oh, fine, thank you."
Okay, goodbye. Anyway, we replace this nucleus, right?
Mm.
And by replacing the nucleus, let's say you got a new nucleus. How's it not going to? How's it going to? You figure it's impossible to stop it completely dead in its track. Degenerative disc disease.
Mm.
And I always make a patient laugh. For example, I had a patient the other day. The patient was 75 years old. She goes, "Doc, how is this going to stop degenerative disc disease?" And I said, "Well, the only way I could look at it to rationalize it is my own rationale on how they could actually say that it lasts forever." Right?
Mm.
I say to them, I ask them, how old are you? 75 years old. Well, it took you 75 years old to get to where you are now. So probably it'll take another 75 years to get to where you are now.
Yeah.
So guess what? You're not going to be around in 75 years. So you could say it lasts forever.
Yeah. Yeah. Oh, the Cosa Nostro has arrived.
What?
The Cosa Nostro has arrived.
No, it's Philip. I called him before and he doesn't realize I'm at the I'm on the show right now.
Yeah.
He's probably taking a shower. But anyway, and it does work amazing. I was giving an example. When a person has, let's say they have a fusion, right?
Mm-hmm.
They got a fusion of this level, right? They got rods and screws going into this level. This does not move anymore. But the level above, these are all mishmash put together. But the level above, which would be this level here, is now going to move, right? It's going to move. It takes the fulcrum.
Oop.
Well, we got a broken back here.
Yeah.
Call Dr. Jasper to fix the back. It's gonna move and constantly move and cause it's by your left foot there, and cause what they call adjacent disc disease. That disc, even if it was perfect before the fusion, that disc is going to break down. It's going to break down. Let's say this is adjacent disc disease. It's going to break down because it's moving and it takes a fulcrum of everything, right?
Yeah.
Well, I noticed a patient about a year and a half ago started to have the beginning of degenerative disc disease. I treat him for arthritis, other stuff. And I gave him an epidural for the pinched nerves because, when it starts to break down the disc, you see the hole where that nerve is?
Yeah.
It's supposed to be that big. Now it gets smaller when the disc gets smaller. So they pinch the nerves and then the nerves swell up like that. I did I put the Viadisc in And usually after a year, when you have the beginning of adjacent disc disease, which is the advancing of degenerative disc disease, a year and a half later, I did a new MRI for something else. It was the same. They had the beginning of degenerative disc disease. By now, after a year, it's going to be more advanced. And I've seen it advance in 6 months.
Yeah.
Once it starts, But so I've seen it myself with the Via disc. It actually stops it, and it gets rid of the discogenic pain.
Right.
That's the most important thing. And that's one of the important things. I think one of the most important things, if somebody like me who really doesn't suffer from back pain, but I have the beginning of degenerative disc disease, which is, for my age, is pretty good. I got a pretty good back after all the stuff that I've done. I think if you give it to somebody preventatively, especially not like me, especially somebody young who has genetically a bad back. In other words,
Right.
some people are predisposed to have degenerative disc disease and all the complications thereafter. And if you put this in as a preventative, right? You put it as a preventative. Look how much money the insurance companies. I mean, they're smart. They're smart, but see, they're not smart to the point where they can prevent having to pay for all the stuff that I do today on patients.
Right.
It probably won't be good for the future for an interventional pain doc, because these are new technologies, new inventions that will prevent it.
Mm.
If you prevent cancer, all the drug companies are not going to make anti-cancer drugs anymore.
Right.
You're not going to do cancer surgery. You're not going to do chemotherapy. You're not going to do radiation therapy, which, by the way, people say it's already out to cure cancer, but you got the lobbyists out there paying off, whoever the hell's invented it, to the point where they might, it's all theory.
Well, that's a theory we all think, that somebody's already invented the cure for cancer, but they're holding it back because it's more money.
They say if Trump invented the cure for cancer.
Did they?
No, they say if Trump invented the cure for cancer, they'd find something wrong with it.
Of course.
What I heard that joke about something wrong with. In other words, he's I don't know, but no matter what he does, not to get political, no matter what he does, they hate it.
They hate it.
Anyway, that's my political statement for the day. But I'm not going to tell you whether I'm Democrat or Republican. I'm going to keep you guys guessing.
She says, yes. Wait, Brenda Starr says, yes, Meg. Don't wait. Dr. Jasper is the best. Smiley face.
Well, thank you, Brenda.
Brenda's awesome.
Yeah.
She's a constant listener. So is Chris Cullen. I haven't seen him today.
Chris Cullen is getting the Via disc.
Is he really?
He's actually. I wasn't supposed to tell you because that's.
Well, he's a part of our show now.
Yeah, he's part of the show. He's getting the Via disc and he's happy with it so far. And what it's going to do for him is prevent it from getting worse.
That's great.
Because he's got a bad back.
I think of Via discs in my future eventually. I can see that.
Well, I mean, you don't. Well, yeah, because you're not Medicare. How old are you?
52.
Oh yeah, you got a long time to go.
Really? Yeah.
Well, yeah, you got to be 65.
Oh.
Or disabled.
I'm disabled.
Yeah, so you probably can get it.
Yeah.
You got Medicare, right?
Mm-hmm.
Yeah, Medicare. People who are disabled. A lot of people are disabled because they inherited the old timers disease early, or they injured themselves.
Well, I had a rough physical life, though.
Yeah, you were a stuntman, right?
Yeah, just petty stuff, but still, I treated my body roughly. I would do flips and rolls, like in a comedy style, and I look back
you were
on
like
all that.
Jerry Lewis.
Yeah, exactly.
Jerry Lewis. He had the worst back in the world. Why? Because he's remember. I don't know if anybody. I'm sure there's.
I didn't know he had a bad back.
Here. You got to see some of his old movies. How he used to. He did all his own stunt work, and he would fall and roll over.
Oh yeah.
I mean, it was funny as hell, but it wasn't funny. He had multiple spine surgeries, and when I started doing this stuff, he was still alive, getting these spine surgeries, and he probably just had spinal stenosis that we could have treated easy.
The reason why he did all that, and same with the Three Stooges, was because they had to make the sounds loud enough for the microphones to pick it up. So they actually had to hit each other really hard or do those rolls really hard and physical just so it would pick up on the
Yeah, you know about
on the
that
mics.
stuff.
Yeah.
You're in the showbiz.
Yeah. Well, I'm a big fan. So yeah.
Yeah. Anyway, what were we talking about?
We were talking about degenerative disc disease and Viadisc.
Yeah, we talked about the snowbirds coming in.
Oh yeah, the snowbirds.
The snowbirds. Yeah, there's a lot of them feeling good today. You know, I mean, I treated so many in the last 3 weeks.
Yeah,
and probably calmed down a little bit. And you know, the podcast. I don't know how many people are really listening to the podcast.
Yeah, we got a bunch of people.
We got to figure out. Well, first of all, I got to be more consistent.
Sure,
right?
Sure.
I'm not consistent because of the fact that how much you're going to talk about. People.
Well, you never know what you're going to talk about, though. You can come out with a story, and that's entertaining enough. I mean, I love just coming in. I do this show with you. How often? I mean, like we've been doing this for years, but I still love coming in and seeing what you have to say. And even I learn so much from just sitting across from this man.
Yeah, we had a couple of stories. Are there any good stories came up the last few weeks?
Well, I just want to announce to everybody that we will be sponsoring the World Cup this year. Okay, locally, and so you'll see the commercials brought to you by Jasper Spine Institute, and as always, as we do every single year, we are sponsoring Shark Week, and so that's a big deal. But our summer's all set up for everyone coming in, and if you plan on coming down to the Jersey Shore and you have a relative that you're bringing in who's suffering from pain, if you're in town, stop by Jasper Spine Institute, see what he says, see what he can do for them. I guarantee you, he can do something. He can fix something in there to make your loved one or your whatever feel a damn side better.
I got a story about a new patient that I got this week.
What's that?
Monday. I had a patient that comes into the office with his wife. His wife I treated 2 years ago. And the wife had severe pain shooting down her leg. What was that?
Well, Vincenzo says good morning, but Brenda Starr says, I love anything you talk about.
Well, thank you, Brenda.
Yeah.
Well, you're gonna like this one. This is a little bit, I gotta really calm down my Italian New Jersey heritage when I hear something like this. Right? I mean, it's very hard. Listen, I'm 70 years old. I'm supposed to be calm. I'm supposed to rationalize things.
Yeah.
But when I hear stories like this, it's very hard to rationalize, right? This lady, I operated on her 2 years ago. She had severe pain shooting down her leg. I did an endoscopic surgery on her. She's not Medicare. The insurance company paid me, but probably paid me very little money for this. Maybe just enough money to pay the overhead. Whereas a friend of mine called and said another doctor's going to do it in New Jersey, the same type of basic procedure, and charge him $30,000 cash.
Oh my God.
I don't charge patients $30,000. I should, but I don't.
Yeah.
I'm not like that. How do you expect these people to pay? Anyway, I took whatever the insurance companies pay for. I got rid of all her pain. She had a herniated disc like this, pinching the nerve coming out of the spine. I went in there with an endoscope, with a little 4mm incision. I don't know if I have the thing laying around here. A 4mm incision. I got it, but don't worry about it.
Okay.
And I went in. It's a scope. I got it on a monitor, and I see everything. I took it out. She came back 100% pain-free. 2 years later, she comes back with her husband. And the husband is 51 years old, 52 years old. He could barely walk. He's walking like he's drunk. He's like grabbing onto things. Like he's not drunk, but he's walking like he's drunk. He has hardly any control of his feet and even his arms to a certain extent. And I said, this guy's got something wrong with his cervical spine. I look at his cervical spine. He's got severe stenosis, where the central canal and the cervical spine is closed down, and it's not closing down on nerves. It's closing down on the spinal cord.
Oh,
And the spinal cord is where all the nerves come out of the brain to go to the lower extremities or
geez.
anything below the neck. So this guy's got he's got severe stenosis that, you know, I can't treat severe stenosis. You know, remember I say I avoid every possible way to send people for major spine surgery, and which, by the way, you know, I sent the patient to Dr. Radcliffe,
Mm.
and he's great. He's a great doctor. I sent him to Dr. Radcliffe. Let's get back to, and he's going to treat him, right?
Mm.
But she says, doctor, I am so upset. I went to a doctor down South Jersey who I don't know. This guy doesn't know me. And she told him that I'm going to go after this for a second opinion to Dr. Jasper's office for my husband. He says, that guy is an effing something, and what he does is all a joke, and none of it works. That's what he said. The guy doesn't even know me.
Right.
How could somebody say that doesn't know me? I might say something bad about somebody who I know that's bad, you know, but never about a doctor.
You don't talk badly about other doctors.
No,
It's just not done.
No.
Yeah.
And you know what she said? She goes, I walked out of there, but I told them off. How could you say what Dr. Jasper does is a joke? Dr. Jasper, he didn't notice. Dr. Jasper operated on me 2 years ago. I had severe pain, sciatica pain down my leg. He made a 4-millimeter incision, went in with an endoscope. She knew what I did. Went in with an endoscope. In 20 minutes, took the herniation out, and I am still pain-free. You know what he says to her? She's a bus driver. She couldn't drive her bus anymore.
Oh, wow. Yeah.
Right? She went right back a week later, drove her bus, and still driving the bus. And he goes, I bet you still have pain. Can you imagine saying something stupid like, she goes, still have pain? She goes, I'm 55 years old. I have pain of a 55-year-old who drives a bus for a living.
Yeah.
You know, I got some back pain, which Dr. Jasper said he could take care of. I got back pain, but I don't have that sciatica pain that I could not walk. I couldn't function. I couldn't eat. I couldn't go to work.
Sometimes
gone.
I couldn't sleep at night.
I wanted the patient's, I wanted that doctor's name.
Mm.
I wanted his name. I wrote down her name, and I wrote down the doctor's name who referred her to him. I got so upset about it. I really shouldn't get upset about that. My mother always told me, people act like that. People act like that who are jealous of you.
Yeah.
Because I used to get so upset. I still get upset when somebody doesn't like me. She goes, those people don't like you because they don't know you and they're jealous of you. So you know what I did?
But she also said that if you got someone like that and you're really upset, put them in the freezer.
Guess what? I put the name in the freezer.
Did you really?
I put the name in the freezer. Why? Because I was going to go over there. I was going to call a guy, confront the guy, report him to the State Board of Medical Exam. I was so pissed off.
Yeah.
So what I did was I said, you know what? Let me make the doctor aware of who he's sending patients to.
Right.
How they're saying bad things about doctors they don't even know out of jealousy. So I figured, let me call that guy. So I call the doctor that sent him. First of all, I get it. You know, normally you get a nurse or somebody, a secretary. Well, how can I help you, Dr. Jasper? I said, I'd like to talk to Dr. So-and-so. Well, no, how can I help you? I said, you really can't help me. Is it about a patient? Yeah, it's about a patient. What's the patient's name? I gave the patient's name. Okay, how can I help you? I said, you can't help me. I want to talk to Dr. So-and-so specifically about this patient, about what happened.
Right.
Okay. I waited 10, 15 minutes. Meantime, I got 45 patients in the office, but I made the time to do this. He gets on the phone, and he gets on the phone with some off-the-wall accent. I can't understand half the shit he's saying.
Mm.
Right. And then I try to give, he says, what's the patient's name? I gave the patient's name. He goes, and then he repeats it with something else. And I spelt it to him. I had to spell it for him 4 times.
Right.
Right. And he goes, all right, what's the problem? And I already told him what the problem was. And he goes, what's the doctor's name? And I tried to, after 3 times of spelling the doctor, I said, you don't know this doctor? He goes, no. And I hung up on him.
Yeah.
I was on the phone for 15 minutes with this idiot
Mm.
who doesn't know who the patient is, which is okay. Somebody calls me, say, I got a patient by the name of this. I probably don't know who it is. I got to look it up.
You have to see their face.
But if they call my office, the nurse will take the name down, the secretary, give it to the nurse will look it up. And before I talk to the doctor, I know everything about that patient. Right. Which is the way you're supposed to do it. I got so fed up. I said, you know what? I'll take care of this guy. Name's going in the freezer.
That's it.
That's all you got to do.
That's all you got to do. Actually, if you look in his freezer, you'll see little faces in the frost in the back of it. Looking up.
My mother taught me that. And you know what? She says you don't put it in there because you don't want to do any harm to anybody.
Right.
People want to do harm to you. These are the people you put in the freezer. It's an old Sicilian thing. And you put them in the freezer, guess what it does? It protects you from them.
Yeah.
And believe me, you ask a few of the people that's fucked me over in the past,
right?
They'll tell you.
Paul,
and sometimes it takes more than just, putting some kind of barrier in front of me. Mm-hmm. Sometimes it takes these people something bad out of their life. I hate to say it.
Yeah.
Don't be barking up the wrong tree here.
We have Neil. Neil says your whole staff is great. We have your niece,
Colapso.
Daniela. She says his niece says hi also, and don't ever change. LOL.
Daniela, when's the baby coming? She's in her last trimester.
Oh, is she?
Yeah.
Oh. Vincenza says, I had that surgery from you. Truly a miracle. My pain was gone.
Yeah. How many years ago was that, Vincenza? Now, that's my sister talking.
Yeah.
And they say it's unethical to operate on family members. Well, who else is going to do it?
Who else is going to do it? Who else are you going to trust besides somebody?
Endoscopic surgery on your family.
Vincenza is also known as Moon Jasper Gem, the psychic online. So if you need a good psychic, Moon Jasper Gem is the one. Then we got Nicole, our beautiful nurse.
Was it Nicole?
Yeah.
Nicole, what are you doing on a beautiful Saturday like today?
She's rained out all of her plans.
Sailing or something.
She says, nice shirt, Doc.
Look, Vincenza says she puts names in the freezer too.
Yeah.
She must have got that from our mother.
Yeah.
And she said she had the surgery 2013.
Right.
How many years ago was that? 13?
Yeah. No. Yeah. 2006. Yeah. 26. Yeah. 13.
13?
Is it?
23? That's 13 years ago.
Yeah.
13 years ago, she had it. Who says these are just temporary procedures? It's a lot of response, people here.
Oh, and Danielle says, I do the freezer.
Daniela puts the people in the freezer too. Why? Because her grandmother was my mother. She knows.
Yeah,
and it works, right, Daniela?
Yeah, you got to lock them up somewhere, and it's better in the freezer than in your head.
I came back from college one time, opened up the freezer, and all these papers come flying out. I said, Mom, what the hell is this? So put them back. Put them back.
That's fantastic. So we are.
I remember one time.
Go ahead.
I remember one time this guy stole. He was actually my partner, and he stole $250,000 from me out of the practice. And I caught him. You know what his first words were? You don't know what his first words were?
Yeah.
Okay, I'm so sorry. I'll do whatever I can to pay you back. Please don't put me in the freezer. I swear to God.
Because people know.
Yeah, because I was his partner for a while, and he knew the consequences of getting his name in the freezer. Guess what? It's still in the freezer.
No, I tell new hires when they come in, right? And they think, oh, is he mad at me? Is he mad? Because you get passionate and your voice gets loud, but you're not yelling at anybody. And it's, well, if you really are worried that he's mad at you, just check the freezer. Okay. If you're not in there, you're cool.
No, I mean, if I get mad at somebody, I don't put them in the freezer.
No.
I get I put people in the freezer like this guy. This guy is trying to hurt me.
Mm.
He's a surgeon. He knows what I do, takes work away from him, even though the guy's probably 50 miles away.
Right.
But they got this family surgeon against doing anything that we do that works. And I don't know whether it's because they make more money doing it, or some doctors I think are honest. I think that this is the only surgery that you can do what they do.
Yeah.
Who the hell knows?
Yeah. But one thing everybody needs to know, once you get in the freezer, there's no getting out. You're in there.
Yeah. Well, unless for some strange reason the person dies, then I'll take them out.
Oh, that's nice, Doc. Yeah, that's nice.
For some strange reason.
For some strange reason.
Which is usually an accident.
Yeah.
So we not only talk about pain on today, which we're finishing up here because you got to do your show.
Yeah.
We're finishing. We finish it off with a little bit of laughter.
Sure.
And most of this stuff is true, but not true. We just try to make people laugh.
Yeah. If you know Doc, right, you love him. That's it. He's one of the great. He's a character.
Well, thank you.
Yeah, you're the craziest character I've ever met, but you're also the most stand-up guy I've ever met.
Thanks.
Yeah.
Thanks. All right, everybody. Jeremy, what kind of show you got in there? Tell the fans over here.
Oh, yeah. Okay. Yeah. So I have a show called Of What Remains with, Jeremy Vickers. And I talk about growing up in the late 70s and early 80s and what's so different today compared to then. And I'm loving it. I love it.
Well, I'm sure you got a great following, probably more than me.
No, you got a lot now. Yeah, you got a lot.
All right, everybody. Thank you very much for listening. Call us at 732-262-0700. I can fix that.
You can fix that. Brenda Starr says she's laughing. She says, "You're killing me, Doc."
All right, brother. Can't wait to see you.
All right. Yeah. So, if you want to make an appointment with Dr. Jasper, like he said, it's 732-262-0700. We are on 92.7 WOBM Sunday mornings from 7 to 8. And if you want to find out more information about the incomparable Dr. Gabriele Jasper, please go to jaspermd.com. Thanks, everybody. Take care.